So we're going to study the bones of the lower limb. On the brown handout that you have, the bone names themselves are in all capitals, okay? So if you were to name the bones themselves, you would just be looking for the words that are printed in all capital letters. The words that are printed in lowercase are features, specific little structures. It might be a hole, might be a little ridge, might be some projection of the bone, any number of things. And those are the things that belong to a certain bone. So when you pick up a bone, like if you knew where the ilium was, if you were picking that up, you want to be able to find all of these elements on that bone. Now, in terms of testing, let's just comment on that a little bit too. In terms of testing, next week's quiz is going to be from pictures, like the ones in your textbook. And as I've said before, if you know the bone well, it doesn't matter what picture I show you, the elements, the features that we're talking about, you will know. Please don't memorize a picture. Don't memorize a picture. You're not going to have a patient come into you, okay, and you're going to go, oh, I can't do anything with this patient. They don't look like the picture I studied. Okay? We are not studying pictures. We're not memorizing pictures for a test. We are learning the real structures of the human body. Many of the things on this list you can feel on your own body right through your skin. And you'll get to know these. So, next week's quiz will be pictures. But 3 weeks from today, these bones that you're handling will be out on the table for you to identify various features and structures. Many of the bones in your box were in one of my tests. If you see a little colored star or a little piece of colored tape somewhere on the bone, that was on there because I was indicating some feature on the bone that a student had to identify during one of my practical exams. Okay? So you've got some of what was on prior tests right there in your box, I'm sure. I'm gonna just take this from the beginning and give you some highlights, and then it's really going to be up to you to take as much time as you need today to then study through this. I'm also a little bit later going to get out the joint list, and we're going to check off the joints that we need to learn. And there may be, I don't remember, but there may be a few of you that didn't finish skinning your cat last week, and we may have to try and get that in right at the end of the period today so that we're ready to go. We want all the cats ready to go next week when we jump into our dissection. So we're trying to get several things done here, but of course this is the most important. Now let me just start at the top. As we study through the bones here, it's really important that you do think these are real structures on people's bodies. You do have some pictures in your textbook that help you with that. Many of these bony features are landmarks that are used for medical purposes or procedures. If you need to give a gluteal injection here, you better be able to palpate a few bony landmarks so you put that injection in the right place and not in somebody's sciatic nerve. Okay? That's knowing the names and the locations of some of these bony landmarks. You know, an obvious one is if somebody says, put your hands on your hips, right? We all do this, don't we? And there's a bony ridge right here that runs right over this edge. It's got a name. You're going to learn it. If you come down further on the leg, there are bony lumps all over the place, right? Your kneecap sticks out, but there's bony lumps on either side of the knee. There's a big one right here. Your ankle is especially big. You've got two big lumps. All tennis shoes have those little U's on the side where the bony parts of your ankle stick out. Your heel bone is prominent. So there's lots and lots of landmarks here that are literally part of what we're studying in this class and will be very, very important. Now, we're studying just this. We're studying, as I've said before, just the lower limb. You can divide this into 4 segments, right? And we're going to do that when we do muscles and some of the other features we're doing. You've got a hip area. You have what we call a thigh area. You have a leg area here. And you have a foot. So those 4, we've got like 4 locations that we're focused on in terms of the entire lower limb. Please be careful, and I get many students that forget this by the end of the class or by the end of this unit, but it will be important. When I say the word leg, I only mean the distance from the knee to the ankle. You and I and everybody, just when they're talking generally and they say leg, they kind of mean the whole thing, don't they? You walk on your legs, and we just think the whole thing. Anatomically, no. This portion is the thigh, and only this portion is the leg. Okay, and if you don't remember that, it'll come back to bite you somewhere. Okay, so please remember that. So in terms of bones, the lower limb is kind of funny because there's very few bones from your hip to your foot. Up here in the hip area, this bone, and you've got one in your box, is called the coxa. All right, can everybody find the coxa in their box? All right, that's one of the 2 hip bones. There are 2 of those. Oh, be aware too, some of you have right side bones and some of you have left side bones. So if you hold your bone and it doesn't look exactly like the picture, you may have the opposite one. I think most of the bones in the pictures in your textbook are right side. If you have a box with left side ones, you're going to have to do a little bit of mental work to make sure that you see how the right is the left and where the features go. How many of you know the name of the thigh bone? Okay. The thigh bone is called the femur. Everybody should have one of those in their box, right? Everybody has a kneecap, don't they? What's the name of the kneecap? Okay, a lot of you know that. The patella, right, is the kneecap. And then when you get to the leg, notice there are 2 bones in the leg. The larger one is called the tibia, and the smaller one is called the fibula. They are side by side. They are medial and lateral from one another. They're not anterior posterior. They're not superior and inferior. They're medial lateral from each other. One of these 2 bones is always lateral. Which one is it? It's the one that says la, right? Fibula, lateral. Okay? This is the one that is always on the outside of the leg. Doesn't matter if you're right or you're left. The fibulas are always lateral. Okay? The tibia, the larger bone, is more medial. And that helps because this is going to have a medial object on it, and this one's going to have a lateral object on it. You wouldn't be the first one to call the object over here the lateral one or the medial one. If you know which bone is which, then you would never put a lateral object on the tibia or a medial object on the fibula. And then finally, we'll just say foot down here. And the foot The foot is very busy. There are 26 bones here. Okay? If you count both feet, 1/4 of all the bones in the human body are in your 2 feet. 1/4 of all your bones are right there in your foot, in your feet. There's a lot of bones in the foot. We'll look at the foot in a little more detail in a bit. I'd like to see if you can take the bones that you have in front of you, can you put them on the table together like they should be if it was a real lower limb? See if you can do that right now. Okay. Everybody listen up, please. Okay, all of you did pretty well on that. The two most common mistakes are turning the tibia and turning the fibula upside down. You know, you might have got lucky, so make sure that you know as you get into this the two ends of the fibula. One end is more ball-like, one end is more pointed or tapered. The ball-like end goes up. The tapered end goes down. The other is make sure you know how the foot fits against the tibia. Most people, when they first do this, they put the tibia on the calcaneus, on the heel bone. It doesn't. You got to turn the foot. Make sure you've got a nice arch in the foot. When you do, the rounded bone called the talus is up, and the foot, the tibia, sits right on top of that. So we'll look at that a little bit more when we get to the arch. Let me take you now through the pelvic area, and there's a lot to learn here. Almost the whole entire first half of your sheet is just bones and features in and around what we call the pelvic girdle. Pelvic girdle implies that this is a circle, that it goes all the way around. You don't see them much anymore, but there were times when women wanted tight little waists and they'd wear a girdle. You know, they'd go, and just squeeze them in, and it completely encircled them, tightened things up. The pelvic girdle here has 3 bones to it, doesn't it? The coxa is the name of the hip bone, like the one you have in your box, and there's a right one and a left one. The third bone is called the sacrum here. Okay, the sacrum is part of the vertebral column. We will study it in detail later in this class. For now, just know the word sacrum. Okay, there is a joint here between the coxa and the sacrum that we're going to learn. And so with these 3 bones, you can see there's a joint here between these two, a joint here between these two, and then the 2 coxa come together in the form of a joint right here in the front. Okay? So you want to make sure that you understand this girdle, this circular structure. This girdle forms a cavity. Remember the cavities? You were supposed to learn 3 cavities. The pelvic cavity is right here. If we cut through it, you can see this space down in here is what we call the pelvic cavity. These are the pictures from your book. There's sort of a pelvic outlet and a pelvic inlet here. You know, the child in a birthing process, the child has to be able to come through this area right here. The word pelvis means a basin. You know, picture a basin, and this hollow space down here is technically the pelvis. We also call it the true pelvis. Okay, that's this area where the cavity is. The organs like your bladder, a woman's uterus, your rectum, from your large intestine, all of these things live down in this pelvic cavity here. So you want to be able to see that pelvic cavity, the bones that form the pelvic cavity, over and against the bones that are up here, over over and against this big flare-like piece. This stuff up here is really just like decoration, in a sense. Okay, it's got muscles that are attached into that. This is the pelvic area right here where the cavity is. Now the pelvic brim, which is one of the things on your list, is going to be this edge of the cavity. Picture this like a cup or a glass. Where is the brim of a cup? Fill it to the brim. Right, it's this top edge, isn't it? Right? It's that top edge. And so if this is a cavity here, right, the top edge is right through here. If you look at the medial side of this bone, right, you should see a very sharp edge running through the bone diagonally like this. And that would be what you would call the pelvic brim. It's marked by the red dotted line here. What you have to do is picture this cavity kind of like this, right? If you can see the whole thing together right here, here's the brim of this cavity down here, right? So that edge running right through the bone here is the pelvic brim. Can everybody find that? I don't have time to stop. If you can't find it, make sure you question me about it a little bit later. But you want to make sure that you can identify the pelvic brim on the bones. Yeah, right there. Okay, everybody good with that? All right. Now, another question that comes up from time to time, and you see this on a lot of the CSI shows or Bones or any of those, is, they'll look at a skeleton and they'll go, oh, this is a female skeleton about such and such age, da-da-da-da-da-da. They're really taking some liberties. It's a lot tougher than they make it appear on these shows to figure this out. There is, though, kind of a natural landmark on male and female pelvises. As you would guess, a female pelvis is usually, not always, but, because there's some variety, but it's typically a little bit wider. And basically what you look for mostly is the angle, what we call the pubic angle. And the pubic angle is right here where the two bones come together. And you can see on a male, this is a male pelvis, the angle here is going to be much more narrow, right, than it would be over here on a female pelvis. And what this does is it just pushes the parts of the pelvis that stick down further out, making the pelvic outlet a little bit larger. You can see that the blue line here represents the pelvic outlet, getting around this, the features here and around the sacrum there, or the coccyx. It's going to be a little smaller here, typically on a male. Again, there's variety, but so you can't always be absolutely sure what you're looking at. But generally, this is true right here. Okay? So, now we're going to look at the coxa. The coxa is that single bone that you have there in your box. The coxa has a lot of features on it because this is the connecting link between your torso and the rest of your lower limb. And so you've got muscles attaching into it from your torso, and then muscles attaching into it from the rest of your lower limb. So this is very busy. This is why this takes up the whole half side of your sheet that we're looking at. Now the first thing that you should get to know about the coxa is that we think of it in three pieces. If you look here, this is the picture from your textbook. This shows the coxa of a child. In a child, there are some soft cartilage places within the bone that allow the bone to expand from the inside out. The bone can continue to grow from the middle of the bone, not just growing from the outside of the bone. And so it's still soft here. And so literally the coxa is in three separate bony pieces with cartilage in places uniting it. In adulthood, all of this solidifies into one solid bone like the one you have in your hands right now. Because there's so much going on here, though, it's useful for us to continue to name each one of the three places separately. It's kind of like labeling different parts of a country when you you don't want to just deal with the whole country, you want to deal with parts of it, so you give separate names to different portions of it, and it's easier. This picture right here color codes the three pieces. And so right away, you want to be able to name the three pieces that you see here. There's three parts of the coxa. Okay? The upper part, the big flat part up here, is called the ilium. Now, where does it end? Well, if you find the big socket here, can everybody see the great big socket on the side here? Okay? The basic crisscrossing here is going to be right through the socket. So the big flat area is called the ilium. Okay, the second part that you want to focus on here is the pubis. Now this lower part is the hardest part. You've got this circle that helps you identify the inferior from the superior parts of the bone. This is the big flare part that's up by where you would call your hips. But it's very hard for students, if they haven't really studied for a while, it's very hard to tell the two parts here. You would know that the pubis is in the front, right? You know where your pubic area is, I think, right? Pubic area is in front. It's called your pubic area because the bone underlying it is the pubis. And that's this piece right here. So whenever you kind of orient the bone, you find the hole, you have to know where the pubis is, and I'm about to show you what that is. But let's get to the third part here. This third piece, the pink part right here, is a little bit gnarlier, a little bit heavier, a little bit more chunky, and it's called this. What's the name right there? Looks like ischium, doesn't it? Many of you look at this and you want to say, shh, right? But it's not. In Latin, this has another pronunciation, right? You and I have an everyday word that we use all the time that pronounces Latin correctly, right? S-C-H-O-O-L. Is that shul? Is that shul? What is it? School. Wait a minute. It doesn't look like, right? This looks like shul, doesn't it? But it's not. And that's because this is a Latin word. Little did you know some Latin. Okay? You always pronounce this school. You take the CH, and for whatever reason, we just kind of we've said this word for so long. We were saying the word before we knew how to spell it, right? And you just took it for granted that the CH was there like a K. But this is true when you're studying bones and you see a CH in a word, put a K there, please. Okay? Take that CH and make it sound like a K. And that's what you're doing when you say the word school. Now, see if you can say the name of this bone using that principle. Okay? So this is ischium, right? The I is like a high I sound. So the bone here is ischium. I guess I make a big deal about this because the way you speak communicates to people what you know. And if you mispronounce things, if you don't say things properly, people are going to think you really don't know what you're doing. You want to be a professional. Okay? And the way you speak communicates that. So this is just one of those little things. I'll be hitting a number of these as we go through the class. So ilium, ischium, and pubis. And the pubis and the ischium together are around this big hole that you see right here. Couple of reference points here. If you look up here on the ilium, notice that one side of the ilium has sort of some shallow little dents, and one edge of the ilium has a great big heavy dent. See that? Right? So the ischium is always right below where this big cutout is, and the pubis is going to be right below where these two little shallow whoop-de-doo things are here. Okay? Whoop-de-doos. Now, I also want to make a point, and this comes back to speaking right, speaking like a professional, using the language properly. I want to make a point here about the difference between a noun and an adjective. I might have done this before. Did we do this last week, 2 weeks ago? I might have, but let me just do it again. You've got your list here, right? All of these features are on the ilium, the ischium, or the pubis. So you're going to find the features here, the features here, the features here. If you take the word ilium, right, that is a noun. That is the name of this bone. Okay, the word ischium, right, is the name of this portion, this bone right here. And the word pubis is the name of this one right here. Now look closely at some of the descriptions here, right? You see all of these? They all say iliac. What is iliac? It's an adjective describing something else. This is an iliac what? Iliac crest, an iliac spine, an iliac fossa. The fossa is the noun, the spine is the noun, the crest is the noun. Iliac is telling you which spine, which crest, which fossa. And you see that again and again. Here in ischium here, it's ischial. So an ischial spine, an ischial tuberosity, an ischial ramus. Not an iliac spine, an ischial spine. And on tests and quizzes and things, I'll get people writing ischium spine or ilium crest, right? Or they'll point to the bone, they'll say, there's the iliac. No, that's the ilium. Iliac is the adjective describing a spine or a fossa or whatever. So just focus on that for a bit so that as you go forward, you begin to use the words right. Here's where the word pubic comes from, right? Pubic is not a thing, it's an adjective. Pubic what? Pubic space, pubic area, pubic hair, pubic whatever. But it's an adjective describing something else. The noun, the bone's name is pubis. Okay? So make those distinctions. All right, as we look at the features of the coxa, let's find the acetabulum. Now I've got 4 items on your list right up here that are on the whole coxa. And that's because like this acetabulum here, notice it's the whole thing, isn't it? This whole rounded socket-like area. Everybody, I don't care what students they get, if I give people a femur and a coxa, they put them together properly, right? Because that round ball-like end of the femur fits right into the acetabulum. Okay? Fits right into the acetabulum. So make sure you can find that. Very important landmark. This is where the 3 bones separate, all of that. The obturer foramen is the hole. One of the things you're doing this time, since this is our first time with bones, you're starting to pick up some words that will be used again and again and again. Crest and spine and foramen and many, many of these words you'll see over and over again, and you need an adjective describing which one it is. This is the obturer foramen, this hole. Foramen in Latin means a window. So a round hole-like opening in any bone is typically a foramen. And then let's describe the lunate surface. The lunate surface is just part of the acetabulum. Okay, the whole socket, all of it, is the acetabulum. A portion of that entire acetabulum is a lunate surface. And it turns out that this is where the hyaline cartilage is that makes the joint soft. When the ball-like end of the femur rubs in here, this is what it rubs against. And any of these bones, if you look in it, you can see the little edge that runs right on the inside. The outside edge is obvious, but you can see the little inside edge that runs right there. The cartilage is only here. And the reason for that is there is a ligament that actually holds the ball head into the socket. There's actually a connecting link, and it runs from here. If you look at the ball-like end of the femur, you'll see a dimple in it. You'll see a cutout in the end. And there is a ligament, there is a band of connective tissue that runs from here to there. So the soft, cushioning, rubbing part is just this lunate surface. Okay? So those are the holistic parts of this. Those are the holistic parts. Now from here, what you're going to do then is take pictures like this or whatever, and you're going to locate the various features of the ilium. Locate the 4 features of the ischium. Locate the 4 features of the coxa. Okay? So what I'm going to do is turn you loose with that and have you work on that in your groups. Just before